Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information. Let me go ahead and introduce who is on our panel today. We are joined by Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, and Dr. Rodney Gonzalez, Director of the Amarillo VA. What we'll do is we'll open it up to our individual panel members for statements, and then we will take questions from our local media members. Let's go ahead and start today with Casey Stoughton. Casey, how are you this morning?
I'm good, thank you, Dave. As we're moving into this first week of August, I want to say hello and thank you to all of our teachers who are getting ready to go back to school. I know there's been a lot of planning on behalf of the school districts, and so thank you those teachers who are getting ready to go back to teach our kiddos. So our thoughts and prayers are with you as you're going back to schools this week. So we'll move into our update now with our numbers. As of yesterday, there were a total of 5,217 cases of COVID-19 in Potter and Randall counties, 3,571 cases in Potter County, and 1,646 cases in Randall County. We have a total of 4,355 recoveries and 66 deaths to report for our community. That leaves us with 796 active cases currently. Each of the cases do represent a unique individual. The Public Health Department drive-through testing site does remain operational. Please call Amarillo Public Health hotline at 378-6300, and our call takers will screen and direct you to the testing site. Coffee Memorial Blood Center appreciates all blood donations. If you have recovered from COVID-19, please consider donating blood today. And if you've not had COVID-19, your blood is still also incredibly important. So please call Coffee Memorial to schedule a donation or find the nearest mobile testing site to donate. Preventing COVID-19 remains so very important. Wearing a mask, staying 6 feet from others, staying home when you're sick, and practicing good hand washing. These efforts can slow the spread of COVID-19 in our community until there's a time when we have a vaccine. We have heard some good news in the past few weeks on the development of a vaccine. We're excited about this progress, and that means so much for our health, our community, and our economy. Vaccines are a unique opportunity to help ourselves and our loved ones. And that's all I have today, Dave.
Thank you, Casey. At this time, let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you this morning? Hello, Dr.
Can you hear me?
Yes, we have you now.
Okay,
How are you?
Good. Okay. Yep. Thank you. Yes, it's good to be back. And then just as Casey had mentioned, I just want to reiterate how important it is to continue to wear a mask and practice social distancing, avoid congregating. And if you're sick, please stay home and try to wash your hands. Also, just to add to Casey's statement about school, that this is the most pressing and upcoming event is the upcoming school openings. And we at the health department will continue to be in constant communication with the various school districts within our jurisdiction. We have been always involved in some of the many discussions in the planning. And there's just no doubt that this would be a challenge, but we will be here to help as much as possible and get people through this. And that's all I have to say, Dave. Thank you.
Thank you, Dr. Milton. At this time, let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss,
well, thank you. Hey, good morning from Northwest. Hey, I know we have talked a lot about the incredible job that our frontline staff are doing, the nurses in both hospitals and the clinics. I want to talk a little bit about an unsung hero, though, which is the Panhandle Regional Advisory Council, or the Panhandle RAC. Now, back in 1992, the Texas government set up 22 of these RACs around the state to coordinate mostly trauma care and emergency preparedness. And since the beginning of this viral scare in this area, the Panhandle RAC has done tireless work to support the 25 counties that they oversee in the Panhandle of Texas. And under Executive Director PJ Lemons and also Kevin Russell and the entire staff, they have helped us obtain the PPE that we need. They've also helped for all the planning and coordination for the alternative care site that we thought we might need if we got overwhelmed. And then recently, they've helped Northwest Texas obtain some traveling nurses as some of our nursing staff has gone out on quarantine because of being positive. So the Panhandle RAC has done an amazing job of supporting us, and I want to thank them personally, and I know Northwest appreciates all the efforts they've made. So let's talk a little bit about the Northwest numbers. Right now, we have 34 positives in the hospital. That continues to be a slow creep upward from July 1st, where we had about 7. We have 21 of these patients in our critical care units, and 8 of them are currently on ventilators. I have to say that what we're doing now for any patient that is on a high oxygen need, we are doing that proning, which means we're turning them on their abdomens to help them breathe. And that's very labor intensive for our nursing staff, but we are trying to keep as many patients off the ventilators as possible because we know they do better by not being on ventilators. And right now we have 17 employees that are currently quarantined, either because of high risk exposures or being positive. Talk a little bit about remdesivir, which is the drug we've been using. Right now we have 94 vials left. That's enough to treat between 9 and 18 patients, depending on whether or not they need 10 or 5 days of treatment. Right now we have 16 patients actively being treated with remdesivir. In total, if you include those 16 patients, we have treated 74 patients in total with remdesivir. Kind of an interesting development. One of the drugs that we've been using is a drug called tocilizumab, which is a drug that's been used for arthritis. And within the last week, the company that makes that drug, Roche, announced that they had a phase 3 trial looking at this drug in patients who are hospitalized with severe COVID-19 pneumonia. And they showed no benefit in terms of these patients clinically from this drug. So that now takes out hydroxychloroquine and tocilizumab as two drugs that we thought might be promising, but now the data is telling us that they're not beneficial in patients hospitalized for COVID-19. We are continuing to use dexamethasone as well as remdesivir for our patients. In terms of testing, right now, in July, we were doing between 320 and 420 tests per week. Now, it's kind of interesting. Back in June, we were getting about a 4% positivity rate, meaning that 1 out of 25 tests were positive. When we look at July, we are now getting just above a 10% positivity rate. So that means 1 in 10 tests are positive. So clearly, we've seen that June was kind of a lull in the action, and back in July and now August, we're seeing this increased percent of positivities in the tests that we are doing. I do want to remind people we are offering antibody testing at our freestanding emergency rooms. It is a cash only, about $120 for the test, takes about 30 minutes. But I do want to remind you, as Dr. Lamentier said last week, we don't know what to do with these results necessarily. We do not think that having antibodies guarantees that you are protected from getting COVID-19 again. The one thing it does do is allows you to donate convalescent serum if you want to do that, if you do have the antibodies. With regard to our own PPE, our personal protective equipment, we're doing very well. But it must be said that we are continuing to be very judicious about how we use it. So we're following CDC guidelines and WHO guidelines because we don't want to waste it. So we are being careful how we use it, though right now we have enough. And just finally, it's been my impression in the community that a lot more people are wearing masks. And I truly appreciate that. I think that is absolutely the right thing to do, as Dr. Milton and the mayor have said. Even more, I want to personally thank those retailers that have made it a priority to have people wear a mask in their businesses. I think it's absolutely critical, and that really helps contribute to the community. So that's all I have this morning. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you this morning?
I'm doing well, thank you, and good morning, everybody. Well, the report from BSA today is really pretty similar to where we were last week. We're a little bit lower in terms of our inpatient volumes today. Last week, we had 37 confirmed cases in-house when I spoke to you all, and today we're down to 30 confirmed cases in-house. So based upon what Dr. Weiss said today, that looks like we have about 67 hospitalized patients with COVID. So really, this is kind of the bimodal distribution of COVID cases we've seen so far. We had that first peak in early May, and now in here mid to late July is the second peak that we're seeing. And we really haven't started to go on the downcline yet, folks. So we really need to continue to be fastidious with our practices in terms of mask wearing and social distancing to try to have this curve take a sharper course downward and hopefully reduce the number of cases that we're seeing. Of the patients that we have in house now, 16 are in the ICU. And of those 16, 7 of those are on the ventilator. We still are seeing about 20 to 30 patients a day come through our specific respiratory triage area in our ER, which is an area that we created to segregate those patients that have presumptive COVID and try to keep those folks in a separate area with separate ventilation. We currently are still dealing with fairly high volumes in our ICU. And we're attempting to closely monitor our elective surgical cases that could take up ICU beds so that we can spread them out when appropriate and when able with collaboration with our surgeons and other procedural physicians that are doing these types of elective cases. It's important that we continue with that type of activity because certainly when we say elective, it does not equate to unnecessary when we're talking about procedures, clearly. So it's very, very, we have to be very careful to make sure we're being clear about that. The next thing I'd like to say is that our testing, similar to what Dr. Weiss said, we're seeing an uptick in positive tests this month. We've done over 6,700 tests since the outset of the pandemic here at BSA. And the overall positivity rate since the beginning really has been hovering in that 18% range in terms of total positives out of that large volume of testing that we've done. It's also an interesting stat, I think, to tell you that we've now admitted over 400 unique patients with COVID-19 at BSA since the outset of the pandemic. And that is a significant number of patients that have been admitted. The overwhelming majority of those patients have been discharged and have recovered. And unfortunately, some of those have not recovered and have passed away as a result of a severe COVID infection and some of the comorbidities that they have. I'd also like to point out that from a treatment standpoint, we have now reached about the mid-40s with total patients that have received remdesivir. We received that drug a little bit later than some of the other facilities across the state of Texas, but now we're getting good allocations of that medication. And although it did not show a mortality benefit, it absolutely did show a reduction in hospital stay. So we still think there is an important role for remdesivir. Dexamethasone, as Dr. Weiss and Dr. Milton have also mentioned previously, is another key piece of our treatment armamentarium. And we've treated almost 200 patients now at BSA that have been admitted with dexamethasone, just as another statistic. And I totally agree with the comments made about tocilizumab. And that is another example, folks, of when we initially jump on a potential therapy with some early data, and there was early data that suggested this drug might be helpful. When additional data comes out that's better, meaning the study is a higher quality study and doesn't show benefit, we need to abandon that therapy. Otherwise, we're subjecting people to costly interventions and potentially harmful interventions that no longer are showing a benefit. So again, we're all on the same page, I think, in our medical community there in terms of how we have to move from where the best evidence lies. The last thing I think I should comment on is that we have recently, with the help of the local Department of Health officials and the CDC, we revised our return to work guidelines to be in line with CDC parameters. It's really helped us in terms of reducing the number of staff on quarantine. We're down to having really about 11 nurses now on quarantine at BSA. And again, the majority of these have been community exposures. Some of them are hospital exposures. But we also modified our masking policy at BSA, where we have elevated those folks that are not taking care of COVID patients into KN95 masks. Again, we're keeping the N95s for those taking care of COVID patients, but an attempt to try to also reduce exposures for staff that are patient-facing. Even when they're not taking care of a COVID patient, we're putting them in KN95s. And that's a conservative strategy that we're doing in an attempt to try to, again, reduce quarantines, keep as many staff as we can available, to take care of patients that come to BSA for all types of illnesses. And it actually looks like it helped us prevent an exposure just this week, which we're happy about. Finally, I'll conclude with echoing Dr. Weiss. The RAC has been a big support structure for us, just like our Amarillo Department of Health officials have been since the outset. We're very appreciative of their work. They continue to send us PPE now, which we're very happy to receive and help to protect our staff. So again, I think the teamwork in this medical community in response to this pandemic has been outstanding. And that's all I have for today.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Good morning. Thank you. First of all, what I'd like to report from the Amarillo VA is that currently we have 2 patients in-house with COVID positive, both of which are in the ICU, neither of one of which is on the ventilator. We do have 22 veterans that we are tracking that are on home self-quarantine. And then we have 1 PUI veteran that we're waiting for the test results to come back. As with the other hospitals, we are doing some elective surgeries, although we do screen, look at them ahead of time, and make sure that it is safe to do it. And as Dr. Lamentier is, make sure that we have the services and support to handle. I would like to remind everyone the standard COVID precautions: wear your mask, good hand hygiene, practice social distancing, and if you're ill, to stay at home. And then lastly, what I just want to say is this Friday is National Purple Heart Day. And so I'd like to thank the many veterans who have earned the Purple Heart. And just as a reminder, this hospital, the VA hospital here, is named after a Purple Heart recipient, Lance Corporal Thomas E. Creek, who earned his Purple Heart during the Vietnam War, and in those actions also earned the Medal of Honor, saving the lives of other Marines while giving of his own. And so with that, I'd like to thank our staff here for what they are doing to respond to the COVID pandemic and what they are doing every day to take care of our veterans. And thank you for this opportunity to the city of Amarillo.
Thank you, Dr. Gonzalez. At this time, we're now going to go to questions from our media members. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with KFDA News Channel 10. I don't want to guess on which reporter it is, but it is KFDA News Channel 10 if I'm not mistaken.
Hey, Dave. Yes, my name is Vanya. Hi, everyone. Thank you so much
Yes.
for your time.
How are you?
I'm good. How are you?
Good, good.
Good. So my question is for either a doctor, any of the doctors. Have you guys seen any patients with complications like kidney injury requiring dialysis, or liver injury, or septic shock? Any of those?
Yes, I could take that. Kidney injury is very common with COVID infection, likely has to do with the cytokine storm. And so certainly we have seen plenty of patients that become severely ill and have evidence of both kidney involvement and liver involvement. Yes.
Thank you. Also, do you guys, have you all seen any indications of the amount of asymptomatic cases that we have in the area, or like an increase or any kind of trends around that?
Well, of course, just the nature of being asymptomatic usually means that they're going to go undetected. And so by nature, it's difficult to document whether someone is asymptomatic or not. But the studies have shown that clearly that it's very common. It's probably somewhere between 20 and 40% of individuals have asymptomatic spread. It's just a very contagious virus. The majority of our testing has been concentrated on individuals who are sick and therefore are asking for testing.
Got it. And Casey, do you know if the cases are still largely spread out, or are there emerging concentrations that we're seeing?
Currently, the cases that we're seeing are still in kind of more widespread clusters as opposed to 1 or 2 large outbreaks.
Thank you. And lastly, do any of y'all know or have any kind of data of how children in the area have been affected by the virus?
I don't
So
have
we
any.
have a
Go ahead, Casey.
So we certainly have we've seen a few children who have tested positive. I think that once school starts, we'll see, we'll have certainly more indicators on how children will be affected, because we'll be bringing larger groups of children together. And so I think, again, prevention is going to be so important as we move into later August and the September timeframe as school starts. But we have seen cases in children. Dr. Milton, did you have additional information there that you wanted to share?
Nothing specific, just that I've been in touch with pediatricians, and it does, and we have seen some cases in children.
I would just say at Northwest, we've had there's a handful of kids test positive, including some infants. As far as I know, we've only treated one non-adult with remdesivir because of the severity of their illness. So thankfully, most of these kids are getting past it pretty well, but we are seeing the positives.
Thank you. Thank you all so much for your time. Appreciate it.
Thank you. Let me go ahead and do David Gay of the Amarillo Globe News was participating. He's having technical problems. Isn't technology grand? So he texted me a question for our medical professionals as a whole. I'm just going to go ahead and read it verbatim. Casey mentioned earlier vaccines. What are the medical professionals' comments on the status of vaccines and what it can do for our community as a whole?
Want to take that, Scott, to start, or?
Yeah, I can at least start on that. There's as people can read in the media, there is a huge effort by multiple companies to develop vaccines for this, and the rapidity that they're able to potentially bring something to market is really remarkable and unprecedented. I think, that being said, there's going to be questions that will remain in terms of the durability